The Office of the Health Ombudsman releasing the report surrounding the circumstances of the death of Shonisani Lethole, who died after he was admitted at Tembisa Tertiary Hospital last year in June. He subsequently tweeted about how he was starved and that his treatment was of poor quality, and shortly after his tweets he sadly passed away even before his results for COVID-19 were confirmed. Now I'm joined by Prof. Makgoba, who just released this report. Sir, thank you very much for your time. Quite a detailed report. But my one question to you, is the hospital, Tembisa Tertiary Hospital, responsible for Mr. Lethole's death?
Look, I mean, they cannot run away from that because they were taking care of him. I don't think that they were trying to kill him. There's a big difference. They were caring for him, but the care failed. So I think there's a difference between those two things.
Yes, the care failed, which resulted in his death, so there should be responsibility taken by the hospital.
I think they are doing that. They have tried to do that, yeah.
Now, just talk to us about some of your findings in the reports. You mentioned some factors that even during your investigation, there were lots of information that was not connecting. There were lots of misinformation, different versions of what happened. Just talk to us about what are your findings and just the experience of investigating this matter.
Well, the experience of investigating this Shonisani's case are simply this, that he was the first case to come to my office during this COVID pandemic. He is a young man who was athletic, he was fit, he had no comorbidities, and there was every reason to think that he should survive or he should have made it through this illness. Unfortunately, as I indicated, his condition, the severity of his condition was not picked up early enough by the medical team that was looking after him. I think that's where the first boat was missed. And from there on, I think it became a catch-up process rather than a proactive process. That's the first. The second thing is there did not seem to be a management plan about how to deal with Mr. Lethole's condition, partly because, as I indicated, some of the tests that had been done were never evaluated, they were never commented upon. So as a doctor, it's very difficult to manage and have a plan on management when you are short of tests and maybe you have not even tried to look at and consolidate your tests. Yeah.
You also mentioned that he was admitted on the 23rd and then also eventually was only able to be seen by a medical doctor on the 27th. I mean, there's
23rd, 26th. He was admitted, as I said, around 12:30 on the 23rd. He was only seen by a clinical associate. Now, a clinical associate is not a doctor, but nevertheless an assistant that evaluates patient at 7:30 in the evening on the 23rd. Now, that's about 5 or 6 hours or so. Then from there, he was never seen by a certified, registered medical doctor until the 26th at 9 o'clock in the morning. And remember, when you look at his tests, they were so severe that you would have thought that every day he should have had high medical attention.
And then who should be held responsible for that period of days where he was not seen by a certified medical doctor, as you mentioned? He was only seen by a clinical associate on the 23rd on arrival.
I have recommendations around that in relation to the medical team. Remember that the medical team in a hospital is often led by a consultant, and the consultant must take responsibility for those kinds of issues.
You mentioned that you also recommend that there should be disciplinary procedures against 19 staff members. Do you feel that those staff members were involved or contributed to the eventual passing away of this patient?
Well, they were involved in the care, so they cannot absolve themselves from the consequences of the care because they were there. And the 19 staff members are largely the nursing and the medical, and then there are others that relates to the kitchen and the food, because that was really the big issue that preoccupied that hospital, the food. Yes, but they are responsible for what happened here.
And he did mention the issue of the food, and in your report you said that for about 100 hours he was not fed.
Yeah, that's correct. 154 minutes he was not fed, and as I said, it happened in 2 stages. The first was when he first came to the hospital. The second was when he was sedated and on mechanical ventilation. So that's what happened here.
We just spoke to the family right now, very emotional, still trying to live with this reality, because as you mentioned that he was a young man, 34 years of age at the time. You said while you were investigating this matter, only one person came forward and apologized or was sorry for the loss of life, but others not so much.
That's correct. In fact, it was the opposite. Others wanted to save their skins. That's all that I could tell. They were saying to the Ombud, look at it from our angle, try and save our skins as professionals. And they never even spoke about Shonisani. That to me was a shock.
Is this a reflection of the general state of public health care in the country? Have you received any other sort of related complaints?
Yes, I've not received one that relates to COVID. I have seen many patients' complaints where I think I've seen many health professionals being very sorry for what has happened here.